everyone, my name is Dr. Abbas and I am Calgary-based hospital and community pediatrician. As you may be aware, World Diabetes Day that is held on November 14th of each year is a primary global awareness campaign focusing on the importance of diabetes mellitus. I am quickly going to cover some facts regarding type 1 diabetes to understand its importance. Type 1 diabetes accounts for approximately 10% of cases of diabetes, and about 86,000 children worldwide develop type 1 each year. When we talk about Canadian statistics, more than 300,000 Canadians have type 1. Total healthcare cost resulting from diabetes management in Canada is about 16.9 billion Canadian dollar annually. According to statistics from Canadian Pediatric Society, nearly 33,000 school-age children in Canada have type 1, and there are several thousands under the age of 5. Approximately 1 million Canadians currently have diabetes without knowing it. What is more alarming is that type 2 diabetes is affecting more and more people, including children and youth. There are several myths around type 1 diabetes, such as your child got type 1 because he or she ate too much sugar. Diabetes is a disease that affects overweight kids only. Girls with type 1 diabetes cannot have children. Or diabetic children should limit their physical activity. Now these are all myths and not facts. But what is true that type 1 diabetes is a lifelong condition. If left uncontrolled or poorly managed, diabetes can lead to serious complications such as heart disease, blindness, kidney failure, nerve damages, and loss of a part of your body. To ensure that this does not happen and your child live normal, active life like other children without this condition, diabetes management team all over the world, including Calgary, are working really hard. As we are all aware, nurses are an integral part of any healthcare system, including diabetes management. This year, the World Diabetes Day campaign focuses on promoting the role of nurses in the prevention and management of diabetes. Therefore, I have invited our very experienced, wonderful, and amazing nurse, Shannon, with us today. Tell us a little bit about yourself and your amazing work that you do.
Sure. So I've worked at the hospital, or at the Alberta Children's Hospital, for 29 years. I've been in the diabetes clinic for 20 years. I work with 5 other nurses in our clinic, and we look after over 1,000 children that live mostly with type 1 diabetes and some kids that have type 2 diabetes. And they range in age from a few months old to 18 years old. So when a child is diagnosed with type 1 diabetes, they will meet with our multidisciplinary team and spend the first 2 days learning the survival skills of living with type 1 diabetes. We also will organize follow-up education sessions, so we'll meet with them after to talk about treatment and prevention of severe low blood sugars, use of glucagon, and illness management. The families are able to communicate with the nurses as much as they want, so they can communicate with us through email or phone. So we do have probably up to 50 to 70 contacts a day. We also have a 24-hour on-call service. So during the day, it'll be one of the nurses that will be carrying the emergency pager and will be dealing with diabetes emergencies. So that's kind of what our team looks like.
Tell me about, as a nurse, what is most rewarding for you?
I think probably the thing that's most rewarding for me is when I get to meet with newly diagnosed families. So those families are very vulnerable, and they're grieving the fact that their child has been diagnosed with a chronic illness. And this chronic illness is different than many other chronic illnesses because it involves, they know there's going to be a lot of poking of our families after they've met with the nurses and spent the first 2-hour education session with them. Most of the families leave knowing that they're going to be able to do these tasks. The second thing that I find very rewarding, caseload has been huge for me because I'm able to meet families when their kids are babies or toddlers, and then I got to watch them grow up into school-age teenagers and then move on to the adult world, and so that's been a really special thing.
How about the challenges? I'm sure that with this process there must be tremendous challenges that you've come across probably, so tell us about a few that you feel important to share.
There are a few, and I think probably the one that I think about at the beginning, it's the wide age range. So you can imagine how different it would be managing type 1 diabetes with a baby, a toddler, a school-age child, and then a teenager. So that looks really different for us. I think the other thing are just some of the differences between socioeconomic things that people will experience. And so that could be things like children that are living in one home versus two homes. And I think just how everything in Canada has changed so much over the last 20 years, and we've got so many immigrants or refugees that have come to Canada, and so that's certainly a challenge. People who don't speak English, and so English as a second language is really tough. Socioeconomic barriers, and I think another thing would be lack of insurance. So for families that can't afford to pay for medication or the expensive diabetes supplies, I think that that's a really huge thing. A third challenge would be just how much diabetes has changed over the last 20 years. And us to stay on top of those changes, we have to be constantly learning, and we've got to change our practice.
In this process, have you learned anything in particular from patients?
I certainly, I think myself and all the nurses, we have a lot of knowledge about type 1 diabetes. Recognize that children and families living with a chronic illness are experts in their child's management, and that we recognize that, and that we're working together to manage their child's chronic illness. So I think that's probably what I've learned the most.
You mentioned that, of course, the care of diabetes and the management of diabetes has changed over the years. How has it particularly changed during the pandemic? Because it doesn't happen often, right?
No, it doesn't.
Yeah.
So it's a scary time for us and for families and everybody, because we didn't know what this virus was going to look like.
Absolutely.
We had to continue to provide the same level of care that we had in the past, but we also had to completely redesign our program and figure out how we were going to educate people remotely. So for sure, for the first education session, the families have to be there with the nurse, because we're teaching them to do finger pokes and how to give an injection of insulin. Everything else we can do remotely if the families want. And so I think for the families, that's been huge. The last thing would be how we do our clinics. So kids with type 1 diabetes have to come and see their healthcare team every 3 months, which is much more than other chronic health conditions. So now with COVID, what we're doing is that a lot of their clinic sessions can be done remotely. COVID, it was really hard for families to get in to see their pediatrician or their GP. And everybody was scared to go to emergency. And so we had emergency rooms that were actually pretty empty, weren't they? So a lot of our kids were quite sick or sicker than they should have been.
What do you feel or what do you think is most impactful?
I think the things that I would hope would be most impactful would, I think that I would hope that our families look to the nurses and feel that we are experts in pediatric diabetes management, that they can come to us for the most up-to-date information, and that we're open to many different ways of managing diabetes. The other thing that would be impactful is the emotional support that we're able to give to families.
Finally, on World Diabetes Day, is there any message that you want to give our community?
One that I would really want people to understand or think about is that type 1 diabetes is an autoimmune disorder like thyroid disease or rheumatoid arthritis. So there's nothing that the children or families did to cause type 1 diabetes. And on the other hand, I would also want people to know that people living with type 1 diabetes can in fact eat sweets and candy, but just within reason, like for the rest of us. And I think the second one is that people recognize how challenging it is working or living with type 1 diabetes, and showing support and respect to anybody that's trying to live with it. It's not something that you can get up in the morning and deal with at breakfast and then not have to think about it again until the next meal or before you go to bed at night. Just respecting the challenge that it is to live with type 1 diabetes is something I would really want people to consider.
Thank you so much, Shannon, for your time, your work, and you're doing an amazing work. So thank you so much again.
Okay, thanks for having me.
You're welcome.